This conference is being recorded. Only the main conference is recorded.
Good morning, everyone. This is Russell Cook from the Silver State Health Insurance Exchange. It's 3 minutes after the hour right now, and it looks like we've got a pretty good group assembled, so we're going to go ahead and get started. As you might have just heard, we are recording this meeting, as we always do. We will post a video afterwards, so just please be aware that the conference is being recorded. And a few more procedural items. Please make sure also that your phones are on mute. You're more than welcome to unmute if you'd like to ask a question at any time, but we'd appreciate it if you could keep your phones on mute unless you have a question. And if you do have a question, you do not have to submit the question by voice. You can use the Zoom chat feature as well if you'd prefer. You can send a private text, or private chat rather, directly to me. We've got one already. It says we've lost the screen share. Thank you very much, Jennifer. Let me get that going again. Okay, hopefully you've got that back. Please let me know if that's still a problem. And just to complete that thought, seems like it's working already, but anyone has the option to send me a chat. You can send one that is visible to everyone, or you can send a private chat that is visible only to me. So hopefully we got the screen share fixed. Please let me know if we did not, and I will proceed with the presentation. So we're going to start as we always do with our introductions. We have Heather Korbieluk, our Executive Director, Ryan High, our Chief Operations Officer, myself, Russell Cook, I'm the Information Systems Manager. We have Eric Watt, who is the Senior Project Manager for the transition. Jamie Sawyer is our Plan Certification Manager. And we have the pleasure of welcoming a new team member aboard today. Lacey Warren is our Reconciliation Lead. We're very pleased to have her on board. She's already been instrumental in helping with our Carrier Connector rollout that happened last week. So we'll talk a bit more about Carrier Connector, and we'll talk a little bit more about the rollout of our reconciliation portal a little bit later in the presentation. So on today's agenda, we have progress since last meeting as well as an overview of OEP metrics. And as I was looking at the progress since last meeting, most of the progress seemed to be related to our metrics and the launch of open enrollment, so I just folded those into a single slide. The second agenda item was not on the agenda that we sent out yesterday, but I realized that we ought to provide an update on renewals and EDI. I know there's been a lot of email traffic regarding the renewal files that we sent out, and we intend to get all this cleared up within the next couple of days. So we're going to provide an overview of where we stand with respect to renewals, the 834 renewal payloads that have been distributed, and what we're doing to address some of the matters that were brought to our attention by carriers. We also have launched Carrier Connector, as I mentioned last week, so we're going to give an overview of the rollout there and provide just a little bit more information, particularly if any carrier personnel have not received their invitations or not received access to that yet. To help you out with that, and you can of course send us an email on the last screen. Eric Watt's email address will be provided, and you can send an email there. So again, just wanted to overview on the Carrier Connector launch, and then we're going to talk in the last two slides about the proposed monthly reconciliation cadence with respect to the RCNI file and the discrepancy report, and then we're going to finish with a brief discussion on the rollout of the reconciliation portal, which will follow a similar pattern to the rollout of the Carrier Connector portal that launched last week. So let's go ahead and get started on progress since last meeting. So this is a big monthly meeting for us. It's the first monthly meeting since we actually launched, and we have a website out there for consumers to engage with. And we are pleased to report, as you're probably already aware, that the open enrollment period launched successfully on Friday, November 1st. We have had zero downtime since then, and while we have had a number of small issues reported to us, we were able to work through them rather quickly, and by and large, we're very pleased with the success of the rollout and the consumer experience as well. To date, 52,844 consumers were passively renewed into 2020 coverage. So that we have migrated somewhere between, I apologize, the exact number in front of me, but it was somewhere between 65 and 66,000 consumers were migrated from healthcare.gov. And of those consumers, 52,844 were successfully renewed via passive renewal into 2020 coverage. And just a quick reminder that the reason the gap is as large as it is between that roughly 53,000 and the approximately 65 or 66,000 that we migrated is because not all of those consumers had provided consent for passive renewal and were therefore ineligible for the passive renewal batch job. But the vast majority of our consumers had provided consent, and accordingly, the vast majority were passively renewed into 2020 coverage. Now, since November 1st, 6,778 consumers have actively enrolled in 2020 coverage. And the way that breaks down is we have had 1,940 new consumers actively engaged with the platform. These were consumers who were not enrolled in marketplace coverage for 2019. They are new to our website, new enrollees for our state, and so far we have accumulated nearly 2,000 new enrollments. We also, and this is a great number, we're really happy about this one, 4,838 of the consumers that I mentioned a moment ago who had not provided consent for passive renewal have already engaged with the platform to actively renew in 2020 coverage. And we are interpreting that as a sign of success in our messaging efforts. For quite some time now, we have been, I believe all the way back to September, we've been providing targeted messaging at these consumers, basically letting them know about the importance of coming online during open enrollment, actively engaging with the platform so that they can renew their coverage into 2020. And that 4,838 represents more than 1/3 of the migrated consumers who had not provided consent for passive renewal. So less than 2 weeks in, we've already been able to get 1/3 of those consumers back online to actively renew in 2020 coverage, and we're considering that a really good sign, especially given that based on past year's metrics, the majority of these consumers tend to wait until the last week or so, and in particular the last few days before open enrollment closes. So what that means in total is that to date, 59,622 members have enrolled in 2020 coverage through Nevada Health. And that, again, is very encouraging to us because less than 2 weeks into open enrollment, we are only a few percent shy of the total number of consumers that we migrated from healthcare.gov in September. And, of course, we've got over a month to go in an open enrollment, so very encouraging numbers there. We also wanted to provide some metrics with respect to our call center. Our call center has handled 13,080 calls, so over 13,000 calls have been handled through the call center, with an average wait time of only 7 seconds before answer and an abandon rate of 0.01%. So people are calling, they're getting through quickly, they're getting their questions answered, and they are moving on with their enrollments. And I did want to mention also that the number 13,080, that represents both consumers as well as enrollment professionals, agents, brokers, and even in some cases navigators calling for assistance with the platform. So we have been able, across all three of those audiences, to keep the wait time well below 10 seconds and an almost non-existent abandon rate. So we're very, very pleased with those numbers. And lastly, I wanted to mention that we have implemented post-call satisfaction surveys through the call center. Now, these are voluntary, so you always have to take them with a grain of salt. Certain people just, they hang up before the survey comes around. But a substantial number of consumers have been engaging with these surveys, and the survey results indicate, on average, a 99% satisfaction rate from consumers with the service that they're getting through the call center. There, we are very encouraged by those numbers, not only the consumer engagement with the platform, but also the satisfaction of the consumers with the call center and the fact that they are able to reach our call center personnel quickly and easily and get their issues in. I can hear a little bit of chatter in the background. If you wouldn't mind, please checking and making sure your phones are on mute. I'd appreciate it. It makes it a lot easier to understand the video recording after the fact when without the background. Thank you. So moving right along, as I mentioned before, we want to provide an update on the current status of renewals and EDI. I'm sure you're all aware that we sent out renewal files a couple of weeks ago, and within a few days, initial renewal files being sent out, there were a few matters that were reported to us by carriers. One of those is that, number one up here, is that the address line 2 field was missing from the 834 payloads. It's my understanding this was a scripting error on our part, and we are working on, if we have not done so already, we might have already regenerated these, but that was a relatively quick fix, and we will be able to provide you with the data that you need, but it's going to depend on a couple other factors that I'll discuss in a moment as to what the best solution is. The second matter that was reported to us is that the NPN number field was not matching, and the values in there were not matching the values that were populated into our system. And when we looked into this a bit deeper, it I believe was the result of a mapping error from the payload that was provided to us by the FFN. You may recall that back at the end of September, I had reached out to carrier personnel to clarify a question that we had regarding the policy ID value. There was more than one data field that reflected a policy ID value in the migration payload that we received from healthcare.gov, and it was kind of a similar issue here. There were multiple ID value fields, all in a similar format of a similar length, related to enrollment professional relationships, and it appears as though we have mapped the wrong field, which resulted in invalid NPN values being provided in the 834 payloads. The good news for those first two matters is that we can regenerate new 834s, and again, depending on carrier's current status of, I'll jump on to number 3 here. With respect to the member ID, certain carriers have reported to us an inability to consume the exchange-assigned member ID, or the SSHIX ID, as I believe it's more commonly known in the carrier world, when those values are greater than 10 digits in length. And as a result, many carriers have not yet ingested the payloads that we sent to them, but we are going to be reaching out to carriers this week to determine whether or not there are any carriers that have actually ingested those payloads. The reason why that's relevant to the first two matters that are listed on the screen, number 1 and number 2, is because if you've already ingested the payload, that would suggest that the simplest solution would be to send you 834 change transactions so that we can trigger an update in your database. But if you have not yet ingested those renewal payloads that we sent you, we are leaning towards regenerating those 834 payloads, having you discard what you've already got, and we will provide you with a new payload that not only has the address line 2 value, but also the correct value for the NPN number fields. So again, the best solution for each carrier is going to depend upon the status of item number 3 on the screen here, and we are going to be reaching out to each carrier organization between today and tomorrow to schedule meetings this week to make sure that we are up to speed. And I want to give a personal apology here. I've been a little bit hands-off. I've been pretty much wrapped up in the carrier connector launch for the last couple of weeks, and I have not been as close to this issue as I would like to have been, but there is no higher priority for SSHIX at this point in the transition than getting these matters with the renewal EDI payloads resolved as quickly as possible and as cleanly as possible for you. So as I mentioned again, we're going to be reaching out to your organizations individually. We want to talk to your EDI teams, figure out exactly where we're at, and we will get you the corrected data in whatever by whatever mechanism makes the most sense for you, depending on your status with respect to number 3. And we will again, it is our highest priority is to get this sorted out within the next couple days. So. Sorry, I was just checking to make sure I got everything. Yeah, I believe we're just tracking those 3 matters right now, so you can expect to hear from us by the end of the day or by first thing tomorrow, so that we can make sure that we get back in sync. Okay, next, I wanted to kind of review the carrier connector launch that happened last week. We launched on Thursday last week, 11/7, and invitations were sent out to personnel who had provided SSHIX with signed access request forms. Now, the access request form had a number of different checkboxes on it. One was for access to the carrier connector casework system, and the other was for access to the reconciliation portal. We have only created user accounts and sent out invitations for personnel who had specifically requested access to the carrier connector casework system. We know there were a significant number of personnel who had requested access to both the casework system and the reconciliation portal. But for those personnel who had only requested access to the reconciliation portal, you will not have received your invitations yet. That is by design because your user accounts have not been created yet. And I'll talk a little bit more about the reconciliation portal on the next couple slides, but I just wanted to mention that up front because a few carriers contacted us and said, hey, not everyone that we submitted forms for got their invitations yet, and the reason for that is simply because they are two different rollouts. Obviously, we needed the casework system up and running sooner than the reconciliation portal, so we prioritized accordingly. For each carrier, we created 3 test cases, and we provided instructions for those test cases in a document that we sent out by email called the Carrier Connector Launch Guide. This was a PDF that provided an overview of the user interface, and it also provided a description in the last section of the 3 different test cases and provided kind of a script for each test case for how to follow it. As of yesterday, 2 carriers had begun testing, and it seems to be progressing smoothly without a hitch. We're about halfway through the test cases for those carriers. I haven't had a chance to catch up this morning yet, but for those carriers who have not yet begun the test process, we would appreciate it if you could do so. The test cases were designed to familiarize you with the user interface and the workflow conventions, and they will also provide a practical demonstration of the automated notifications that are generated by the system. So the second test case, for instance, starts as a level 2 priority, and after you begin testing, we escalate it to a level 1 priority. That escalation will trigger an automated email notification to your entire case team, and we want you to see what that looks like before we actually have to press that into service. Similarly, the third and final test case represents a new level 1 case, which will trigger an automated email notification as soon as the case is created. But again, we are waiting for carriers to complete their account registration process and to engage with the first of the test cases so that we can make sure your account is registered before we send out those automated notifications. The automated notifications will only be sent to user accounts that have already completed the account registration process, so that's the reason for the staggered timeline of those 3 test cases. As I mentioned, testing is currently underway and is proceeding smoothly, but we do invite the rest of the carriers that have not begun testing yet to please do so at your convenience. And just wanted to reiterate that to date, SSHIX has not received any consumer complaints which would require the use of Carrier Connector. I know this was a concern for a number of carriers last week because we missed our November 1st launch date. There were some environmental issues, particularly with respect to our test environment, that caused us a delay of several days, and we do apologize for that, and we appreciate you bearing with us. The rollout, although it was a couple days later than anticipated, is fully functional, and we do have a production environment ready to go should the need arise to handle a collaborative case based upon a consumer complaint. Now, I mentioned in the email that I sent out to the individuals that had requested access that as a result of those environmental complications that we had with the Salesforce platform, we went ahead and did our launch directly in the production system. So the credentials that you've created for those of you that have completed your account registration and the URL that you log into, that is the production system. And once testing is complete, we will delete those 3 test cases that we have created to ensure that we are starting from a clean slate. Those 3 test cases, by the way, the name of the name of each case includes the words test case, and the consumers that are associated with this case have bogus names, test consumer A, test consumer B. So there shouldn't be any risk of mixing those up with actual production cases. But I wanted to mention that nonetheless and assure you that we will be deleting those test cases once testing is complete. And I think I alluded to this earlier, but please note that we have not yet launched our reconciliation portal. We've only launched Carrier Connector, the casework portal, so if there are individuals that only requested access to the reconciliation portal, they will not yet have received their user account invitations. So next we wanted to talk about the reconciliation cadence, which is going to be occurring on a monthly basis. We have conferred with a few other states that GI operates in. We've also conferred, Get Insured is GI, sorry. And we've also conferred with the CMS team that runs reconciliation. And we have decided to align ourselves with the submission schedule that is mandated by the FFM. So we are requesting, therefore, that carriers submit their RC&I files by the 9th of each month. And we are requesting also that the first RC&I submission take place in January, i.e. by January 9th. We will then process the RC&I file each month and produce a discrepancy report within 3 business days of submission. And so with respect to the January submission, we understand that there's not going to be a lot of action with respect to practical reconciliation available to us in January on account of lingering effectuations. And, in talking with our carriers, some had suggested that we wait until February, but we had discussed also the possibility of doing essentially kind of a soft launch in January so that we can work out the kinks if there are any in our process. I know on my end, because this is a very new function to us, that we would really appreciate the opportunity to have a bit of a trial run in January and make sure that when February rolls around, we are ready to hit the ground running. So the January trial run is not only going to allow us to kind of verify the legitimacy of the process, but it's also going to provide an opportunity to carriers to familiarize themselves with the forthcoming reconciliation portal and with the proposed workflow. Now, I believe that we will be able to have the environmental issues that prevented us from setting up a test environment for the Carrier Connector portal. I'm hopeful that we will have those worked out by mid to late December or so, such that we can actually utilize a test environment for practical reconciliation activities that will not necessarily have an impact on the production system. In other words, a true test environment and a true opportunity to work through these discrepancies and interact with the system without fear of messing anything up in production. And then, of course, practical reconciliation in terms of, actually doing this in earnest and really, working to resolve all of the discrepancies prior to the end of February. That's going to begin in February. And lastly, I wanted to talk a bit about the rollout of the reconciliation portal, which of course will support the process that we described on the previous slide. The reconciliation portal is currently under development. As I mentioned a couple slides ago, we had prioritized the rollout of Carrier Connector because we knew that we were going to need a casework system in place before we actually started doing reconciliation. We anticipate a soft launch in mid to late December with test exercises similar to the Carrier Connector rollout. So we've been in communication with Salesforce to work through the issues that prevented us from being able to use the test environment in that capacity last time. What that boils down to is that they want us to pay more for a more expensive test environment, but we think that the value of that is going to be worth it. So we're working on getting that implemented in time for a mid to late December rollout. And then, as I mentioned on the previous slide, January is going to be used to familiarize your personnel with the portal and to refine the workflow based on carrier feedback. And this applies to both this concept of refinement based on carrier feedback is something that I really want to promote with respect not only to the reconciliation portal, but with respect also to the carrier connector portal. As those of you who may have engaged with the carrier connector portal have probably noticed, we took kind of a minimalist approach, which we still think provides a substantial number of workflow advantages over the SSHIX system, but we didn't want to do too much guesswork about what you might want or might need before we had a system in place that covered the basics. So our goal was to provide the minimum amount of functionality that we knew would be required to effectively work these cases. But dashboards, complex reporting, that sort of thing, are still in the works, and we would very much appreciate any feedback, any suggestions that carriers have. You can send your comments, questions to me. I believe I had requested feedback if you had any questions, any concerns in the emails that I sent out on Thursday of last week. Please feel free to reply to those email threads with any suggestions. In particular, if you're scratching your head wondering, well, where is this essential function that I used to use in the SSHIX system? It may be something that we overlooked because we had read-only access to the SSHIX system and we had some basic user reference documents from CMS. We never had the opportunity to actually interact with that system and simulate the workflow that was required under the SSHIX environment. So again, we are very much looking forward to a dialogue with carriers so that we can turn both Carrier Connector and the reconciliation portal into a tool that makes your lives easier and increases the efficiency of both your casework and your reconciliation activities. This is being developed, both of these portals, entirely in-house, largely by myself, and it is a very flexible, very nimble platform. That's one of the main reasons we chose Salesforce in the first place. So we are committed to refining both of these tools to make them work for you. So again, please keep in touch, keep the lines of communication open, and to the extent that you can let me know what's missing, we can get working on it. We can get that into our release schedule and keep you apprised of the progress. And then lastly, I just wanted to mention, I believe I've alluded to it in the spiel I just gave you, but we will be contacting carriers, reaching out to you over the next several weeks to review the proposed workflow and solicit feedback for this reconciliation portal. Unlike the casework system, which we had a pretty good frame of reference in the SSHIX system, and we also inherited a pretty significant amount of built-in functionality from the Salesforce platform, which itself is a very mature and very full-featured casework platform. We don't have a similar frame of reference for reconciliation activities. We've never done this function before in-house. We have always relied on CMS to provide this function for us. So while we have done a significant amount of homework, we've talked with a substantial number of states, I believe a half a dozen other states, as well as CMS's reconciliation team, we still want to know what your experience is with CMS, how you're used to doing things, and in particular what you like and what you don't like about the reconciliation process with healthcare.gov. Now, we do intend for the reconciliation portal, just as with Carrier Connector, that we will evolve this functionality over the first couple months so that we can refine it and really make it work for you to the greatest extent possible. But we are dependent upon your feedback. We are dependent upon your suggestions to provide us with the inspiration and the guidance that we need to get us there. So I will be heading up the reconciliation team. As I mentioned earlier, we have a new hire, Lacey Warren, who's going to be our reconciliation lead. I'll be supervising her work as well as she'll be supervising another individual intern on the reconciliation team. And so Lacey and I would very much like to sit down at the table with each of you for at least a few minutes and run our proposal by you and then capture any immediate feedback that occurs to you so that we can really spend the month of January kind of refining the workflow rather than developing the workflow from scratch. So that's all I had for this month. As always, please feel free to email myself or Eric Watt with any questions, and I wanted to make sure we provide an opportunity to all of you now to raise any questions or concerns that you might have, whether they're related to open enrollment or the casework system or reconciliation. Please feel free to jump in and submit a question by voice, or if you prefer to use chat, I'll give you a couple minutes to do so. All right, I'm not hearing anything, and I'm not seeing anybody typing in the chat. So I'm going to go ahead and cut it short and give you 27 minutes of your morning or afternoon back. Thanks, as always, for joining us. We really appreciate the great turnout today, and we couldn't be more excited about what the next couple months holds for us. So please, if you have not done so, go ahead and engage with the Carrier Connector system. We can't wait to hear your feedback, particularly any suggestions you might have. And keep an eye out on your inbox for information related to the rollout of the reconciliation protocol. And as I mentioned earlier, most urgent, most important, we're going to be contacting you over the next couple days, your EDI teams, to make sure that we understand your current status with respect to the renewal payloads, and so that we can do whatever we need to do to make things right and fix the address line 2 and the NPN number discrepancies. So thanks again for joining us, and we will be in contact very soon. Take care.